So welcome to the Urban Indian Health Institute Health Data Literacy Training, number 2. And this 2-part webinar series, accessing data.
With CPR, you call on 301. With CPR, you call waiting on 301.
Could you say that again, please?
I think we're getting some feedback from some people's phones and audio. So if you can press the mute button in the corner in Zoom. If you're accessing the webinar by phone, you can dial *6.
Mm-hmm.
Yeah. And that way we can just hear the audio a bit more clearly in case anyone has questions or anything.
And so this 2-part webinar series will be about accessing and using data. And as we go through this, we just want to remember that when we're talking about data, we're also talking about people. And so it's important to use the data in a responsible and appropriate manner. So I'm glad to see that there's so much interest in accessing and using data. So thank you all for participating. My name is Alyssa Yang, and I'm an epidemiologist here at the Urban Indian Health Institute. And then I'll let Shanoa introduce herself.
Hi, Chef Maisky. Good morning. My name is Shanoa Pinkham, and I'm a project assistant here at the UIHI on Yakima, Southern Cheyenne. And I'm happy to see, hear and notice so many of you have registered today. So we're really excited to begin today's webinar and to share this information. And we just hope that it'll be productive and helpful for all of you as you work with your communities.
And then also, if you need us to repeat anything, please feel free to just let us know or send us a little message in the chat function. Shanoa and I both have colds, so we can be a little hard to understand sometimes. And then just a few housekeeping things. Please fill out the evaluations afterwards so that we know what works, what doesn't work, what you would like to see in future trainings as well. And then last but not least, just a little reminder to please put yourself on mute so that we don't have any background noise coming through in the speakers. But of course, feel free to unmute yourself if you have any questions during the webinar, or if you prefer, you can always ask your questions in the chat box as well, and we'll be monitoring that as well.
Mm-hmm.
And just a quick acknowledgement here. Thank you to the American Indian and Alaska Native Health Disparities Grant Program and the Office of Minority Health for funding this training. And also a big thank you to Shira Ruttman, our evaluation manager and epidemiologist here, as well for laying down the groundwork for these webinars.
Hi, just real quick, I think the screen is sharing, but let me see. Can you all see the screen that says Urban Indian Health Institute and our mission statement?
I can see it. This is
Can you? Okay, great.
All right, great.
Thank you. So, yeah, we just want to go into a brief introduction about us at the UIHI. So our mission is to support the health and well-being of urban Indian communities through information, scientific inquiry, and technology. And basically what that means is we conduct a variety of public health and research projects that range from surveillance and analyses to technical assistance and trainings like these. As you all know, our Native population in the cities represent an invisible community and can really slip through the cracks. So we're here to try and fill in that gap in information. We were established in the year 2000 as a division of the Seattle Indian Health Board, which is a community health center here in Seattle that serves American Indian and Alaska Native. The UIHI is one of 12 tribal epidemiology centers, or TECs, that serve everywhere in the United States. Ours is the only one that has a national focus. Most of the TECs have a regional focus, but we work with TECs all over. And We also work with our urban Indian health organizations. There's 33 of them, and as you can see, we have them categorized in 3 service levels as the IHS defines them. Here we are in Seattle. We have comprehensive clinics, limited clinics, and outreach and referral clinics. And all these serve our Native people in the cities nationwide. They range from services to health and social to community, traditional medicines and such like that. And Alyssa will now discuss our project for today.
So today's training comes out of UIHI's project called Demystifying Data. And so this project focuses on increasing the awareness of health disparities that urban natives face, and it does so in 3 ways, through information, through partnership, and through training. And so the health data literacy training is really just to show all of you that you can work with data too. And it's a way to translate these numbers and results into a tool that can really help you to tell your story. And so another tool that is available to all of you are the in-person trainings that we did in the past. So back in 2009 to 2012, we used to do an in-person one-day training for the staff of UIHOs and other interested agencies. And so this training included information on things like the importance of health data for urban natives, data limitations, commonly used epi concepts, effective communication and presentation of health data, and then plans for how to use health data in your agency. And so if any of you are interested in those training materials, just feel free to let me know and I'll send it over to you. And then after those past trainings, people had indicated that they wanted a step-by-step training on how to access data and how to use it. And so that's where the ideas for modules 1 and 2 came from. So that's just another plug. Please fill out those evaluations and let us know what you want to see. And then just a quick overview about our training goals for today. Today's module will be about accessing data, and so we're going to learn how to locate and export data on American Indians and Alaskan Natives, specifically looking at CDC Wonder. What is that? Well, we'll get into that in the presentation. And then the second webinar will also be about using and presenting data, and that'll be on February 26th, 3 weeks from now, so pencil that into your calendars. And I'll walk you through how to put together a graph in Excel, and then also how to write up a few interpretations of the data. So then just a quick outline for today's training. We'll be talking about the opportunities for using health data, some of the common health data sources out there, some of the limitations associated with it, and then how to use the data even with its limitations, and then a couple of different ways that you can access data, and then we'll go step by step through how to use CDC Wonder, looking specifically at sexually transmitted disease morbidity data. And then we'll also talk about some of the other STD resources out there in case you're interested. And then we'll go through a sneak peek on what Module 2 will be about, and then a quick summary about what we just talked about. And so one of the reasons for doing this webinar is to highlight the many opportunities that exist for utilizing publicly available data. And so listed here are just a couple of ways that health data can be used, like to establish program priorities, to evaluate the satisfaction of program participants, to support funding and political advocacy, to put together the background information on those fund and grant applications, to create reports on community health status or needs, or to present on agency services and achievements. And I'm sure you know of many more yourself as well. And so here are just a couple of categories of the different types of common health data sources. such as mandatory reporting systems, surveys, and other. And we're going to go more in depth about each of these categories. So one category is mandatory reporting systems. And so our first example here is vital statistics, and that is sometimes known as vital records, and that includes birth and death certificates. Our second example here is disease registries, and this is usually based on hospital-based data, and that includes one example is the U.S. Cancer Statistics Registry on cancer incidence. Our third example here is disease surveillance, and so this type of data is usually based on data that comes from health departments. And we'll be talking specifically about the sexually transmitted disease morbidity data for today's webinar. And then our fourth example here is clinic or administrative data. And so much of it is used for only internal or local uses, but some of the data can also be required to be reported to different systems, such as GPRA, or the Government Performance and Results Act, or healthcare financing, so we lump that in there as well. And then another common data source are surveys. And so these are available at every geographic level, national, state, local, and they can be used in a variety of settings. So they can be used at schools, in homes, in clinics, over the telephone, etc. And so here are just a few examples of national surveys. Our first example is the Youth Risk Behavior Survey, also known as the YRBS, or sometimes we call it YRBS. I tell you this so you can talk like an Epi. And so YRBS has information on 9th to 12th graders, and it also talks about topics like unintentional injuries and violence, sexual health, alcohol and drug use, diet, physical activity, and such. And then our second example is the Behavioral Risk Factor Surveillance Survey, BRFSS, sometimes called BRFS. And this has information on health-related risk behaviors, like whether people are using their seatbelts, how often they're exercising, what kind of chronic conditions they have, what kind of health screenings they're doing, just to name a few. And these first two, YRBS and BRFS, they're administered by the CDC. And for our third example, we have the National Survey of Family Growth, NSFG, and that has information on topics like marriage, divorce, fertility, sexual and reproductive health. And then the fourth example, the National Health Interview Survey, NHIS, that also has information on like health status and limitations, healthcare access and use, and also what kind of health insurance people are using, so that sort of thing. And these last two examples, NSFG and NHIS, they're both administered by the National Center for Health Statistics, and so we'll take a closer look at the NCHS in a little bit as well. And then last but not least, there are also satisfaction surveys, and these can be conducted with different audiences, such as employees, patients, students, and program participants. And then for our other category, we just have a few examples of those. And for the first example, it's the U.S. Census, and that's the one that's done every 10 years, and it captures the whole U.S. population. And then for our second example, we have the American Community Survey, ACS, and that's part of the 10-year census that we mentioned before. But it's done every year, and it only includes a small percentage of the population, and it has information on like jobs and occupations, educational attainments, race, ethnicity, and housing info, like whether people are renting or owning a house, that sort of thing. And the ACS is a survey as well, but we also just wanted to point it out because it's pretty unique. Then we also have, for our third example, hospital discharge data or other administrative or patient record data. And then for our fourth example, we have environmental data. And one type is the U.S. Environmental Protection Agency's air quality system. And that has information on air pollution and temperature, and that comes from air monitors across the U.S. And then the EPA also has some water quality data as well. And so the data that we're talking about right now has mostly been quantitative data. So that's information that's displayed with numbers or counts. And so another type of data that we haven't talked about yet is qualitative data. And that includes data that comes from focus groups, interviews, and digital stories, for example. And that's displayed with quotes, words, or images. And then I'm just going to stop here briefly and ask, I know that was a lot to take in about all those examples. Does anyone have any questions about those different types?
No.
Okay. Well, we'll move on then. Go.
Actually, this is Heidi. I have a question.
Yeah.
Are these all, do you have to be affiliated with an organization to get access to some of these, or are these all pretty easy to access?
So some of these are available on like the CDC website where you can just download it.
Okay.
But you can only download like the national data set. I know for the YRBSS, they can, that's available where you can publicly download the national data set. Some of the other ones, like the behavioral risk factor surveillance system, you can also go to that website and they'll have like a query system similar to CDC Wonder, the one we're going to go through, where you can actually type in like what you're interested in looking at. If you want the raw data, they might have that available, but you'd have to check the website.
Okay.
Yeah.
Okay. Thank you.
Great. Yeah, speaking of limitations of data, I can move us into our next discussion. Oh, and there's actually a question here. Are these slides going to be available after the presentation? Yes. So we will be posting this recording and the slides onto our UIHI website, and we'll be able to send you guys that link. So yeah. But yeah, let's just take a moment to discuss the challenges that we've often faced when trying to get data on urban natives and natives in general. So first of all, sometimes data isn't shown for the group of interest, like at the county level or urban natives. So instead, data is only presented like as a whole, as a national whole, kind of like, yeah, like kind of like the census, but sometimes it's not always broken down in other cases. So it might not be representative of individual states or counties. They'll just say, oh, as a nation, this and this or whatever. And then secondly, sometimes data isn't grouped into the other category because of a small sample size. So sometimes it'll just be lumped together as one giant like minority group or whatever. And just kind of going off of that, often natives, especially urban natives, are even misclassified. So I know my grandma, for instance, when she had my mom on her birth certificate, it was like, oh, other, or it said white or unknown or something. So she wasn't even classified as a native. So that happened, but sometimes, yeah, there's often misclassification racially or whatever. And then lastly, sometimes, as Alyssa said, and as the question was said earlier, sometimes the data just may not be available publicly and will require a proposal and payment for access, which will take time, but yeah, so these are just these ones. However, we can still use data. And, yeah.
And so even though it's data has its limitations and it can be problematic, we can still use what we have. This imperfect data can still be effective in bringing in new funding, specifying programs and the need for your work, and presenting what's known or not known about your community to garner support for local projects or assess local needs. So here are just a few suggestions on how you can use imperfect data. And so these ideas address the issues with small sample size, and we'll talk about it a little bit more in depth in the next few slides. But I also just want to point out that it's important to include notes stating where the data comes from, describing the known limitations, and then how those limitations impact the results you're sharing. So don't forget to do that. Okay. So then one thing you can do is look at your area of analysis when using imperfect data. So you can combine multiple years, geographic areas, or subgroups like expanding your age ranges or including both genders to increase the small sample size. And then another thing that you can do is also to use data on a specific tribe or region, even if it's outside of your area, because that tribe or region might have similarities to yours, or it can show the need for data in your community. And then in the demonstration that we're going to do, you might want to look at a whole region or group of few states in order to get a better sense of your population when the number of cases, also known as the numerator, is too small, or when the denominator is too small as well. And so another method that you might want to also consider is using a comparison group. And so you could use data on a group with similar characteristics to your community, like similar levels of income, similar levels of educational attainment, similar health conditions, that sort of thing. You could also use data on related health outcomes. So for example, if you have breastfeeding data, you could share other available maternal and child health indicators, like the number of baby-friendly hospitals in the area, or the number of prenatal visits. And then, if available, you could use data on one select racial group as a baseline. Your comparison group could be whites to highlight the disparity, or it could be another racial ethnic minority group, depending on what message you want to send or what data you have available. And then even if disparities aren't seen with your comparison group, or if there's simply a lack of improvement over time, that's still important to highlight. It still has meaning. If there's no improvement over time, maybe the intervention needs to be, or maybe more resources need to be allocated in that direction. So it's still important to point that out. And then another thing that you can do is also to consider using comparisons to national targets like Healthy People 2020. And then a third method is to look for alternative sources. So if the data source isn't publicly available, you could try searching for relevant reports or journal articles online where the data has already been analyzed by someone else, like the CDC. But of course, make sure that it's coming from a legit source and that they've measured and interpreted the data appropriately. So you still have to do your research on them.
So when we talk about accessing data, one of the first ways we can do that is through accessing static websites. And when we say static, we just mean that looking at reports, fact sheets, stuff that has already been reported on doesn't change. You can't interact with them in the same way, but the information is already there. And this first link that we have here is to a CDC report. This is done every year. It's called Health in the United States, American Indian Population. And then the second one that we have here is through the OMH, and we have minority population profiles. I'm just going to click on this one real quick to show you guys what it looks like. And this one's pretty cool because it has national data that you can click on little tabs. It's really open. All right, here we go. Oh, sorry about that. And basically, you just click on here, and it's organized by area, which is pretty cool and really helpful when you want to look at a region, as Melissa said, and it gives an overview, language, educational attainment. Yeah, this is just a good little intro and stuff on static data. And then this other way you can access data is through interactive websites. And basically, these are the ones where you can look through drop-down menus and click through tables, and really lets you be in the driver's seat when it comes to what you want to look at, how you want to look at it. It's organized by like topic or geographic area or age group, etc. So these three are all CDC websites. This first one is called the Health Data Interactive. This includes CDC data sources and has information on mortality and life expectancy, health conditions, pregnancy and birth, etc. And the second one is Whiskers. Whiskers. Which basically stands for Web-Based Injury Statistics Query and Reporting System. That one's kind of a mouthful for me. But this one basically has injury data. It includes statistics on suicide, motor vehicle accidents, injury due to falls, etc. And then this last one that we're going to look at today is Wonder, wide-ranging online data for epidemiologic research. So it's acronyms. But this one basically includes various data sources and pulls up detailed tables from vital statistics, for example. This is one that we're going to go through for today, and basically we're going to use this one to access STD morbidity data. So let's look at that. Yeah, I would really highly recommend looking at this one just because it has a cute little cat logo with on it. I thought that was interesting.
And then just so that you know, the PowerPoint that we send out to all of you has screenshots of the step-by-step process and red arrows indicating where to click, so that if you ever want to go back to this in the future, you'll have that available to you. And then it's also important to note that this demonstration is being done in Internet Explorer, so if you're using Google Chrome or Firefox, it might look a little bit differently for you. And so before we get to CDC Wonder, let's take a quick look at the National Center for Health Statistics website, because they have some really great resources that I want to highlight to all of you. So as we scroll down, we see that there's this little section for surveys and data collection systems, and that has links to a couple of the surveys that we had talked about previously, like the National Health Review Survey or the National Survey of Family Growth. But they also have a link to NHANES and the National Care Survey. So that's something that you might want to look back at and explore more of. And then as we scroll further down, there's also the data access section, and that has a link to CDC Wonder, and also the Health Data Interactive that we had talked about earlier. But they also have some additional links to like the Health Indicators Warehouse, and also the National Death Index. And then one that you might be more interested in is the Research Data Center. So if you want to access publicly available data, or where it's not available to the public because of the small sample sizes, you can go to the Research Data Center to fill out an application. There might be a fee associated with it, but there might not be. So that's just something to keep in mind as well. And then there's also another section called Additional Resources that has some static websites, such as the fact sheets and Healthy People 2010, 2020, that you can refer back to. And so let's go to CDC Wonder. And so here is CDC Wonder, and it has information that ranges from AIDS public use data to births and cancer statistics, They also have environmental data and mortality as well. And then for our purposes, we're going to look specifically at the sexually transmitted disease morbidity data. And so here we just have a short description on the data source. So it's coming from the National Center for HIV/AIDS, Viral Hepatitis, STD, and TB Prevention, NCH/HSTD. Public health, we gotta love those acronyms. And so that data has information on the 50 U.S. states and the District of Columbia, and Puerto Rico, Virgin Islands, and Guam, and then how it's broken down. And so we have two links here to the STD morbidity data. We want to go with the second link because that's where we'll actually get to talk about race ethnicity data. So we'll click on that, and then we have a drop-down menu to choose from. So there are 4 here. For the first section, that'll be how we want to organize our table. And so let's group the results by disease. And then they'll further break it down in the rows by our second option, which we're going to go with race ethnicity here. And then we'll also add in gender just so that we can have a more narrowed focus. And as we scroll further down, we have our second section, select location. And so you can choose the whole US and DC, or you can choose individual states, or if you hit Control on the keyboard and then click a multiple selection, you can hit a group of states as well. So for this demo, we're going to go with Michigan, since that's where I'm from. Go blue. And we will scroll down to the third section and look at selecting disease, age, race, ethnicity, gender, and years. And so we'll leave the default of looking at all diseases. And then for our years of data, we'll go with the most recent 5 years. That's usually a good standard to go with. And then for age, we'll look at 15 to 19-year-olds. And then gender, we'll leave it as all genders. And then for our race ethnicity, we want to look specifically at American Indians and Alaska Natives. And so we're also going to use a comparison group. And so we're also going to hit Control on the keyboard and click on white. And then we'll scroll further down.
What was that?
Does anyone have a question? So then for the fourth section, that's our other options. And so we're going to leave it as a default right now. 2 decimal places, good standard to go with. And then when we want to calculate rates, we usually do it per 100,000 people. Sometimes you might want to drop that down to 10,000 depending on how the data looks and what message you're trying to send. And so we'll go more in depth about per 100,000, per 10,000 in the next webinar. And so we're going to hit send. And then we have our data displayed here. And so we have it displayed by row, the disease by row. And then it's further broken down into American Indian or Alaska Native and white. And then from there, it's displayed, broken down as female, male, or unknown. And so this red message at the top, that's not an error message. That's just telling us that the rows with 0 STD cases are hidden. So if we want to see that, we can go up to the quick options and then show the 0 rows. It just does it like that to give you like a cleaner table. And so then we'll scroll a little further down, and so then we have our notes section. And so here are some of the caveats that come with the data. It's really just our limitations. things like chlamydia wasn't reported for all of New York State in the years 1996 to 1999. So things like that. And then we also have a little in our help section over here. If you click on the link, it will tell you more information about how all the indicators were measured and defined, just for more information. And then for the suggested citation over here, remember that we always want to cite where we're citing our data sources. So where is it coming from? So that's good to have there. And then we also have the query criteria. And this just tells us what we chose to get our data table, just in case we want to ever go back to it again. So let's go back up to the top. And so over here is a link to help with exports. And so this link will tell you how to export the data into Microsoft Excel, Microsoft Access, Epi-Info, and SAS if you want to get super fancy. And so there are a few ways that you can export the data. One way is to click Alt print screen on the keyboard and then copy and pasting it into a Word document. Or you could also do it a second method where you hit the export button, which is what we're going to do. And then it'll ask us if we want to open or save the text file from CDC Wonder. We're going to go with save and then save as. And so for our purposes, we're just going to save it on the desktop, but for when you do this, you might want to save it to whatever related project file folder that you have, and then save it with a name that makes sense to you. And I would recommend putting the date on there as well in case you ever have to go back and download the data again. So we'll just put the year, 2016, month, 02, and date, 05, and save it. Okay, and then we're going to go to our desktop. And so right here, we see that we have a text file that we just downloaded. And so we see that the data fields are separated by 5 or 6 spaces. So we say that the data fields are separated by tabs. And when we're talking about separating the data fields, we're talking about delimiters. So that's important to note for when we're importing it into Excel. So let's close out the text file, and we're going to hit Excel. And then we're going to open a blank workbook. And then we're going to go to the Data tab at the top. And then we're going to go to From Text. So that's going to import the data from a text file. So we'll hit that, and then we will click on the file that we just downloaded, and then we'll hit Import. And so then it shows a text import wizard window. And so this has asks us like, oh, how's the data being delimited? So we're just going to leave it as a default. It's a delimited file. Just hit Next. And then it asks us how it's being delimited or how is it being separated. So then we're just going to leave it as tab because that's what it is. But sometimes the delimiters, just so that you know, can sometimes be semicolons, commas, or a space. And so we're going to hit Next. And then we're going to leave it as a default as well for general. And so we're going to hit Finish. And so it's asking us where we want to import the data in the workbook. So we're going to choose the A1 cell so that it comes out nice and clean, and then hit OK. So then now we have our data imported into Excel. So then we're going to save it on the desktop, But again, you can save it however you would like to. And then that is what we have for the demo right now. But before we leave, we are going to talk about some STD resources that are also available to you as well.
Yeah, so these are 4 kind of, again, static data accesses that we can look at. So this first one here is an IHS STD report. This report presents STD morbidity trends and statistics in the U.S., and nationally and by IHS region. Some of these particular limitations are that the denominator is IHS eligible population, so basically tribes. As stated in this particular report, the data specific to urban Indians and members isn't included, but still useful information. And then this next one is our very own UIHI viral hepatitis and STI prevention project. So basically this was free technical assistance that we provided to UIHOs nationwide to address these issues, and it basically we helped develop culturally appropriate health promotion materials targeted for urban Native communities. So feel free to look at that one as well. And then this third one is the IHS Primary Care Provider, April 2010. This recent issue highlights noteworthy program partners of the IHS National STD program and their efforts to reduce STD morbidity in Indian country. And then this final one is the Morbidity and Mortality Weekly Report from January of last year. I've heard this often called MMWR, keeping up on those acronyms. But basically, this report is on the incidence of notifiable disease among American Indians and Alaska Natives, including STDs. This one particularly, I believe, took place during 2007 through 2011. But yeah, basically, just looking at these ones, you can also go, you may also have access to your local county or state reports, or might be able to receive data by requesting it from these agencies, which in some cases might save you the time and effort, but it's good to know how to do it yourself too. Yeah.
And so now that we've downloaded the data, for the next webinar, we're going to talk about how to analyze it, how to create a graph in Excel, and then how to write up a few interpretation statements about the data. So that's just a quick sneak peek. And then just a quick summary, health data is a powerful tool, especially for the Native communities that you serve. There are a variety of different types of health data sources and many ways to access these, including online avenues, such as the examples that we just talked about today. And then all data have limitations, but there are often ways of using imperfect data rather than nothing at all. And then with all the details, it's also important not to lose sight of the fact that when we're talking about data, we're also talking about people. And so we want to make sure that we're using the data in an ethical and responsible way and in the best interests of our communities. And I know that I'm preaching to the choir here, so thank you for all that you do and for participating in this webinar. So now I'll open the floor for if anyone has any questions. Okay. I'll also point out that we have our contact info over here, and then I will also put in the chat function my contact information, and then also send out the link to the survey, to the evaluation. So please let us know what you would like to see, or if this worked or didn't work for you. Just yeah, give us like whatever feedback that you have. And then we'll stay on for like 5 more minutes in case anyone else has questions. But yeah, thank you so much for participating. I hope to see you at the next webinar in 3 weeks. Happy Friday.
Yay!
Thank you.
Thank you.
Thank you.
Everyone.
Thank you.